At this time, I want to turn to the gentlelady from Illinois, Ms. Biggert, who has been such an active voice, not only in the Education and Labor Committee, but in the House as a whole, as she has led on this issue. And I yield to the gentlelady.
I thank the gentlewoman from Tennessee, and thank you for having this tonight. You know, I was just thinking that I've got 4 children and 8 grandchildren, and so I think as a mom and a grandmother, I've always been very concerned about health care and want to make sure that my family has the best that's possible. And when I was raising the children, all we had was Dr. Spock. We didn't have all the technology and all the wonderful drug therapies and the health care that we have now in the United States, and I'm always concerned about the quality of health care. We want to make sure we need reform, but we want to make sure that there's that quality of health care that we have now. And we've got moms, doctors, nurses, caregivers, and taxpayers, and women that really play a critical role in the health care debate. And 85% of women are the primary health care decision makers in the home. And that's why we take this so seriously. And the U.S. Census Bureau reports that 82 million adult women are moms, and 32 million women have a child living in their home. So women are overwhelmingly supportive of health care reform, but they want to know that this reform will improve the quality and affordability of their current health care. So many women and their families, higher health care costs means the difference between receiving care and going without. So unfortunately, the Pelosi health care bill empowers government bureaucracies and undermines a woman's ability to make the best health care decisions for her and her family. I've got a letter that one of my constituents sent. It's from Mary Ann, and she writes to me, as a registered nurse and mother of a severely disabled child, I beg you to seriously consider the long and short-term effects of the new health care proposal. I'm horrified to think that medical decisions will be determined by our government. I have seen this fail in many countries. I happen to be of the opinion that the precious commodity of life far exceeds the almighty dollar. You know, one of my daughters lives in London, and when this bill came up, I said to her, "Now, seriously, tell me, what is the health care like in the UK? What is it like versus here?" And as a matter of fact, every time my daughter brings her my 3 grandchildren home for a visit, she takes them to see the pediatrician that I took her to see, just to make sure that they're in the best of health can be, and make sure that that somebody from the United States is looking after them. And she said, well, now in London, it's a different system. It started out where doctors don't have this high debt. They don't have the high costs of the medical school that we have here. It's paid for. So they started the system, and they're in the public system. And then some of them become private doctors. Now, my daughter has the public health care, but she also has the private doctor. And she said, well, in emergencies, it's really you're well taken care of. But it's the long term. When let's say she gave me the example. Let's say you have a rash on your arm. You go and they say, we'll make an appointment for you, but the appointment is 9 months later. She also said if you go on and check on the wait list, the current wait list in London, for example, the current wait list at the time that I checked was 11 months for a knee replacement, 10 months for a hip replacement, 5 months for a slip disc, and about 8 months for a hernia operation. And these are just the few of these that they wait so long for. Now, what that leads to also is rationing. And I had an event this morning where one of the doctors stood up and talked about his belief that there would be rationing, particularly with how many doctors are going to want to remain in a situation like this where they really become staff. We think of them as professionals. I always thought, oh, if I could be as smart as the doctors that they to me was just the profession that was so outstanding. And so this leads not only, to rationing for these procedures, but also we've had a debate